Chapter 8, Lifespan Development. Oops. Topics. We're going to talk about infancy, beginning 1 year to 8, beginning birth to 1 year. Toddler phase, 12 to 36 months. Preschool age, 3 to 5 years. School age, 6 to 12. Adolescence, 13 to 18. Early adulthood, 19 to 40. Middle-aged adulthood, 41 to 60. And late adulthood is 61 years and older. Let's start talking about infancy, or birth to 1 year. Nice little picture of a little baby. All right. Physiology. Average babies at birth are 6.6 to 7.7 pounds. This is the average. This doesn't mean this is what they have to be, right? They can be a lot larger, and they can definitely be smaller, like preemies. Now, the baby's weight will double by the 6-month mark and even triple by the 12-month mark. The baby's head is about 25% of the total body weight, right? They got big old heads on floppy bodies. Their airways are going to be narrow, short, and easily obstructed. And their nose and diaphragm breathers, right? This can be an issue when they start getting congested, especially in their nose, and they don't breathe as well because they're nose breathers. We talk about antibodies. They're passed from mother to a child during pregnancy. This is something that they will lose eventually, right? This is called a transferred immunity. They'll lose it eventually, and they'll start getting their what they call acquired immunity. We'll talk about it in a later phase. Antibodies also can be passed through breastfeeding. Let's talk about babies' reflexes. They have 4 different reflexes. The moro, or the startle. This is when you have like a sleeping baby and you walk up to them or say something, and they jump up, and they're not jump up, but the arms will shoot out, the fingers will spread, and so this is when a baby's startled, the moro reflex. The palmar. This is when you put your finger in their palm or anything and they grip it. It's a natural reflex for a baby to do that. The rooting or hunger reflex. This is when they'll turn their head to whatever side you touch when you touch their cheek. So if I touch the right side, they're going to turn their head to the right, even when they're sleeping. The sucking reflex. Sucks when their lips are stroked. So if you touch your baby's lips, they start sucking. Let's talk about their sleep patterns. Initially, they're going to sleep 16 to 18 hours a day and night, right? Baby sleeps a lot. Soon they'll change to 46 hours during the day and 9 to 10 at night. And eventually, by 2 to 4 months, they'll usually be sleeping throughout the night. The baby's extremities grow through a combination of growth plates on both ends of the long bones. This can be important when we're talking about bone fractures later on. If the bone gets fractured on these growth plates, it can cause the bone to grow irregular or not grow at all. So they could have a shorter limb because of this. Fontanelles. These are the baby soft spots, right? You've heard people talk about the baby soft spots. They have 2. They have a posterior, which is on the back of the head, and an anterior, which is more on the top of their head. So the posterior will close about 2 to 3 months, and the fontanelles or interior fontanelles will close about 9. It takes about 9 to 18 months before they're fully closed. These are openings in the top of the skull, and it allows their skull to grow as their brain grows and as the baby grows. And eventually they'll get fully grown, and these fontanelles will fill in or harden. A sunken fontanelle, especially the interior, is a huge sign of dehydration. So if you got a sick baby, been vomiting, got a lot of diarrhea, he get dehydrated, and you'll see this dip in the top of their head, or sunk-in fontanelle. A bulging fontanelle without crying indicates increased pressure inside the skull. Certain infections, trauma can cause the brain to swell, and these fontanelles will bulge and then they're crying without crying. This could be that they're building some pressure inside the skull. Babies' most form of communication or psychosocial is crying, right? That's how they tell us they need change. They're hungry. They want to be held. But they also have this bonding, the sense that when their needs are met, they're bonded, especially with their parents, especially their mother. Trust versus mistrust. Um, Desire for an orderly, protective environment. Baby wants to feel safe. Scaffolding means they're going to learn by building on what they already know. So what they know and they build onto this. And the baby's temperament is how he reacts to the environment. Kind of his attitude, his temperament. Let's talk about the toddler phase. The terrible twos, right? 12, 1 year to 3 years, or 12 to 36 months. There he is, already wasted water, right? All right. Physiology, their body temperatures can range from 96.8 to 99.6. Weight gain will be on average about 4.4 pounds per year. And their body systems will improve in efficiency. They're starting to get those fine motor skills. The pulmonary system, their terminal branches, airway branches are growing. So their lung mass is getting larger. The villi increase in numbers. Nervous system, the brain is 90% of the weight of an adult brain at this age. Like I said, they're starting to develop those fine motor skills, like being able to grasp stuff, reach down and pick up stuff. Muscle skeletal system, the muscle mass and bone density will start to increase. Immune system, more susceptible to illness because they're losing that passive or transferred immunity from their mother. Now they're starting to get that acquired immunity where they're acquired or the immunity is being built because they're being exposed or vaccinated. Their teeth, all their primary teeth are coming in by 36 months. This is your baby teeth, the primary teeth. Toilet training is physically possible between at the age of 12 and 15 months, but not psychologically possible until 18 to 30 months. So they physically can go use the toilet 12 to 5, but they're not really understanding or grasping the concept until they're about 18 to 30 months. And this depends on the child. Social, they begin to understand that words have meaning, especially words like no, right? They're starting to understand what those words mean. They begin to understand cause and effect. Again, if I do this and my parent says no and I continue to do that, I may be able to get punished. They will develop separation anxiety at this age group. If you've ever had a young kid and had to drop them off to daycare or school, you know what I'm talking about. They become leg huggers at this point. They'll begins to develop magic thinking and imagination and play acting. Their imagination starting to grow. And they're starting to master language basics that are refined throughout childhood. So they're starting to talk, uh, making more sense. They're being able to put sentences together, master language basics. Let's talk about the 3 to 5 year olds, the preschool age. The body systems continue to develop. They start to develop interactive and social skills. Why is this? Because we're putting them with more kids their age. So they're starting to develop those social skills. Peer groups, right information about other families and outside the world, right? We're talking about their mommies and daddies and other stuff. Interaction offers opportunity for learning, making compromise, and a big part of a group. The school age children, 6 to 12. Body temperature is going to range from 96.8 to 101.3. Average weight gain will be 6.6 pounds a year. This is where they start growing quite a bit. 2.4 inches a year is average. And their primary teeth will be gone and they'll start to get replaced with their firmer teeth. This is where we start to have to pay the tooth fairy at the school age. Psychosocial. Parents spend less time with their children and provide just a general supervision. They can start doing more things on their own. Their decision making skills will develop at this age. They start to develop a self-esteem and can be affected by how popular or rejection or emotional support and neglect. They're starting to develop their morals at this stage based on the reward and punishment for their behaviors. So they learn what's right and wrong from us rewarding them, that a boy, or punishing them for misbehaving. Moral reasoning appears and control of behavior shifts to internal sources. So they're no longer dependent on their parents for their behavior. They're starting to develop their own. Adolescence, 13 to 18 years old, teenage years. Uh, Psychological, rapid 2 to 3 year growth spurt begins with growth of feet and hands, then arms and legs. Females hit this stage before males. Usually, I think the book states that females are usually done growing around the age of 16, and boys could be up to the year of 18. Sexual maturity is reached, and secondary sexual development occurs. Sexual maturity in females is the onset of their menstrual cycle or their period. And usually with males, it's the development of pubic hairs. The social, uh, psychosocial, they strive to be independent and individual identity, right? They don't want mom and dad's help them more. They can do it on their own. They start to get an interest in sex. Body image becomes a big concern, especially with females. They be prone to self-destructive behaviors, and personal code of ethics start to develop. Early childhood, 19, early adulthood, early 19 to 40 years old. We'll start that over. Early adulthood, 19 to 40 years. The psychological, lifelong habits are forming. This is where we start to develop both good and bad habits. Like, for example, good would be a healthy lifestyle, good healthy eating, exercise. Um, Examples of bad habits would be smoking, drinking. Peak physical condition occurs between the ages of 19 and 26. What this means is that your body will function at its utmost best between these ages. It's fully developed by the age of 19, and we start to see the slowdown or the beginning of the slowdown around the 26 years to 30 years old. Psychosocial, jobs and family stress levels are higher, right? With marriage, we're starting to get kids, and child rearing occurs, right? So stress levels go up. Your job causes stress. Accidents are the leading cause of death in this age group, because sometimes those develop bad habits. Some of it's because of our work, right? This is the working age people, and they're younger, so they're going to take the more high riskier jobs usually. Middle agehood, between 41 and 60 years. Psychological effects of it. No significant changes in our vital signs. Let me state this: your book has vital signs for each age group. You should look at them and learn them. Visual correction may be needed. This is where we're starting to need the glasses or contact lenses. Cancer, high cholesterol, and heart disease often develop because of our bad habit choices or our lack of exercise in our earlier age. Weight control becomes more difficult because our metabolism is starting to slow. Menopause may begin for women at this age group. Psychosocial effects, task-oriented, starts to increase because we have lifelong goals, and we're getting at that age where we don't have as much life left, so we're going to try to hit these goals. So we're more task-oriented. Problems may be viewed as challenges rather than threats. We're starting to see the empty nest syndrome in this age group because at this point, our children are all grown and starting to go on their own. So we're getting empty nest syndrome. They're concerned about both their children and their elderly parents, right? You're right in the middle. So you're worried about your kids, but you're also worried about your aging parents at this point. Because if you're 60, on average, your parents are going to be in late 70s, early 80s. Late adulthood, 61 years and older. Psychological vital signs depend on health and physical condition. This is very true, right? Certain conditions can affect certain vital signs. For example, blood pressure. Medications can do this as well. And your body system starting to slow down. So the cardiovascular system is less effective when blood volume decreases. Your respiratory system will deteriorate, and the likelihood of respiratory disorders will start developing. Endocrine changes decrease metabolism, so you're slowing down. Your sleep wake cycle is disrupted, and other body systems deteriorate as time goes on, right? The older you get, you're starting to get wore out, your system starting to go wore out. Psychosocial changes. Face many challenges like the living environment, self worth, financial burdens, death, and dying. Um, we get to a certain age, and can we live on our own, or do we have to be placed in like skilled nursing facilities or assisted living? Their self worth, they don't think they're worth anything. They think they're a burden. Financial burdens, they don't have as much money, so they may feel their financial burden on their families, or they may have to start choosing between buying food and buying prescriptions. And death and dying, they're seeing their friends and family starting to die, so they starts to look at their own uh, death and mortality. Motivations, personal interests, and activity levels be enhanced, can enhance late adulthood. Let's review a little bit. Understanding the basic psychologic and psychosocial developments for each age group will assist you in communicating and assisting with patients' various age. So if we know how developed they are, we know how we can communicate. Psychological differences between the ages will also affect your care. Example, including differences in respiratory system of younger patients and the effect of pre-existing medical conditions of older. Infants and young children have less developed and smaller respiratory structure, which may make respiratory condition worse. Your ability to communicate with younger people will depend on their stage of development. This can range from fear of strangers to separation anxiety from parents and embarrassment during adolescence. That's why if we have a female adolescent patient, we should have a female provider if possible, or vice versa. Older patients may have issues with denial or depression over medical conditions, right? Depression is huge. It's huge among the elderly. If you ever go to a nursing facility, assisted living, one of their listed medical history is usually depression. Infants undergone big bursts of anatomical and psychosocial development in their first year. Although preschool begins to develop independence and reasoning, in many ways their psychosocial development is similar to that of toddlers. School age children often are independent in logic, but they may regress to an earlier stage when illness or injury. So they may want to be independent until they get hurt, then they want their mommies, right? Adolescents are reaching psychological maturity, but they often face difficult psychosocial challenges, like wanting to fit in. This is where the herding mentality starts. They want to fit in with their peers. Uh, yeah. Early, middle, and late adulthood adults very greatly in terms of psycho developments and conditioning. They also might face psychosocial challenges unique to the adulthood.